morning, our mentors, our trainers and teachers, senior colleagues, and our colleagues. On behalf of the President, the Executive Committee, and the Board of Trustees of the Nigerian Society of Anaesthetists, I welcome you all to our 8th webinar series, the third section, which is a case-based discussion for our candidates going for exam. Thank you all for your support and cooperation. And now I will hand you over to the Education Committee, the Secretary of the Education Committee, Dr. Oranusi. Thank you. Dr. Oranusi, please take over, ma'am.
Thank you very much, Dr. Shelley. I'd like to welcome our dear participants to today's webinar. And today, on behalf of the chairman of the Education Committee, I'd like to say a big welcome, Professor Deti. I'd like to say a big welcome to every one of us. Today, we are having the third session of our 8th webinar series. And like advertised, we have the case-based discussions today. And our moderator for today is none other than Dr. Adam Ahmad. He's a consultant anesthetist and medical director of the Ture Umar Yar'Adua Maternity and Children's Hospital, Katsina State. And we also have our panelists whom the moderator will introduce. So now I'd like to offer the floor to our moderator, Dr. Ahmad, to commence the duties for today. Thank you very much. Dr. Ahmad, you have the floor.
Thank you so much, Dr. Oranusi. I welcome us all, the participants, our panelists, and thank you so much, Madam President and the Chairman of the Education Committee, for this opportunity given to us to moderate this session. As is mentioned, it is the third session of the 8th webinar series, and it is going to be case-based discussion. And we are with two panelists, the professor and consultant anesthetist, Dr. Henry Y. Embu, who is in the Department of Anesthesia, University of Jos. And second panelist, Dr. Samuel Nuhu, who is associate professor as well, and a consultant anesthetist in the Department of Anesthesia, University of Jos. We are both welcome. The rules, as usual, we have 10 minutes to discuss each question. So each panelist will have 10 minutes to go through with the candidates of his choice based on the questions shared to us. I think our first panelist, Professor Henry, would take the first question. We should be time conscious. We have only 10 minutes for each question. So which you should discuss the case within 5 minutes. I'll notify you when it is 5 minutes so that you know that you have 1 minute to round up. Then the floor will be open for the panelists to discuss and make some corrections and amendments before we go to the next question. We would like to round up the session within 1.5 hours, that is 90 minutes. So we want to take as much questions as possible. If you have any queries or contribution, kindly either put it on the chats or raise up your hand so that you'll be given some time to say at the end of the session. Thank you, and over to Professor Henry, please, for the first question. Prof.
Thank you so much, Dr. Ahmad. Yes, I'm here. I'm around. I'm here.
Yeah, welcome, Prof.
And thank you so much, Dr. Ahmad, and thank you, NSA, for the privilege of asking me to take part in this. And I think it's a good way for NSA's contribution to training of anesthetists in Nigeria. So without wasting much time, I will just ask, I'll read out the first question, and then I will maybe choose from the list of candidates somebody to answer the question. So the question goes like this. A 60-year-old man who is with type 1 diabetes is scheduled for laminectomy